Hello viewers, welcome to my channel Healing Hands. In this video, today we are going to learn some of the important terms, meanings and important abbreviations which are commonly used in the nursing course. Are you eagerly waiting to learn this topic? Okay, let's dive in.
Okay, let's start the video. Some of the important terms, meanings, definitions, and abbreviations used in nursing. Okay, let's start with the nurse. Who is nurse? Normally, who is nurse? Nurse, a person which provides care to the patients in the hospital. Okay, what is the definition of a nurse? Nurse, nurse, a person who trained in providing care to the sick people. Who is a nurse? Nurse is a person who is trained and trained in providing care to the sick people. Understood? Nurse is a person who is trained in providing care to the sick people. I hope everyone understood. Next, nursing. Nursing is a art and science. Nursing has a unique function that is to assist individuals in the sick performance of those activities and contribute to health and recovery. According to Henderson, what Henderson told here, nursing is a art and science. Nursing has a unique function. It assists and it helps the individuals or sick people in helping them to recovery from the disease condition. Understood? Next, moving to nursing or another definition, nursing. Nursing is the act of utilizing the environment of the patient to assist in his recovery, according to Florence Nightingale. What Florence Nightingale is saying, nursing is the act of utilizing the environment of the patient. Like we are utilizing the environment according to the patient condition. Here we are providing the care to the patient to help in his recovery. Understood? I hope everyone understood the nurse and nursing definition. Next, what is the abbreviation of a nurse? Nurse. Nurse. First, nurse. Nurse. N means noble. Noble means kindness. A nurse should show kindness towards the patient and family member. While providing care to the patients, nurse should be in talking with the patient or family members in a polite manner. So, showing kindness towards the family members and patients. Next, you understanding are useful. Nurse should understand the needs, emotions, or perspectives, and what the patient is feeling. Should understand the patient's emotions, feelings, and the family members. Next, R for responsible. Should be responsible for the patient. Next, simplicity. Being simple and uncomplicated. The nurse, it is the simplicity is the first quality of the nurse. Simplicity means being simple, not uncomplicated. Nurse should be simple, should not be uncomplicated. Understood? Next, empathetic. N completed, U completed, R completed, S completed, E. Empathic. What is the meaning of empathic? Empathetic or empathic? Empathy means to understand the situation or the problem of the patient, we have to imagine that we are in the place of the patient. Then only we can understand the feel or emotion or the pain of the patient. Next, what is empathetic means? Imagine ourselves in the place of the patient, then we can understand or feel the situation of the patient. So by assuming as we are in the place of the patient, then we can understand the pain or feel of the patient. Understood? Moving to definition of health. Definition of health is important in this nursing. Next, health. Health is a state of complete physical, mental, socially well-being, and not merely absence of disease or infirmity. Infirmity means physical or mental weakness. What health, when we call a person is healthy, when the mental status, the physical and socially well-being, if the person is physically, mentally and socially well-being, when we call him as healthy person. Understood? It is according to WHO, World Health Organization. Next, profession. Definition of profession. Basically, what is the meaning of profession? Profession means it is a occupation or work which we do. Okay, profession is an occupation that requires extensive training and has ongoing research. Means there's nothing. Profession is a occupation which we work. Understood? Or profession refers to an occupation which requires some specialized studies. To get into the occupation or work, what we need some specialized study and training, and the purpose of which is generally to provide skills, services and guidance. What is profession? Profession is a occupation, means work which we require specialized study and training to get into that profession. Understood? And next, moving to abbreviations used in nursing. These are commonly used in nursing course. Hmm? First, C by O. C by O means complaint of. When a patient come to the OP to the doctor, he says complaints like he's having fever, chills, nausea, vomiting. So what the doctor writes, complaint of C by O, and his doctor writes the nausea, vomiting, fever, and chills. Next, O by E, on examination, means when a person admitted in the hospital, the examinations means what the investigations underwent, what the result came, the doctors write. Doctor writes the O by E. Next, H by S, hour of sleep. Hour of sleep means how many hours we are sleeping. How that. Next, ROM, range of motion. Range of motion. Range of motion means exercise, like extinction, like that. Next, I by O. I by O means intake and output. Intake means how much amount of the food or liquids we are taking in the 24 hours. Next, output. How much amount of the urine output is coming, that is I by O. That is urine output, I by O. Next, rule out. R by O means rule out. Next, C by S by B. Next, K seen by. These are mainly written in case sheets by the doctor, case seen by. When the doctor sees, when the doctor goes for rounds, when he see a new case, he writes like C by S by B, case seen by, and writes the vital signs and the condition of the patient. Next, K by O, K by C by O. Next, known case of. Next, S by S, signs and symptoms. Signs and symptoms means like when we go to the hospital, what we say when you are suffering with fever, what we say like fever, chills, nausea, vomiting, like that. These are signs and symptoms. Next, NPO, nothing per oral. Before any surgeries, the patient should be fasting for 6 to 8 hours. So that we call nothing per oral. Next, ADL, activity of daily living. When a person is suffering with a disease condition, he cannot do the daily activities. So that is called daily activity. Means what are the activities daily we are doing. For next, OD. OD means once a day. Means when a doctor prescribes a medication, he writes OD, BD, TD, and A. OD means once a day. The medication should be taken only one time in a day. Next, BD, twice, two times. The medication should be taken two times in a day. Next, TID, thrice, morning, afternoon and evening we should take. Next, QID 4 times a day means the medication which are written by the doctor, which are prescribed by the doctor, we should take 4 times in a day. Next, bun, blood urea nitrogen levels means if a person is suffering with the when a person is suffering with the any infections or any disease condition, we can check the blood urea and nitrogen levels. Next, cbp means complete blood picture, or we can also write at complete blood count. CBP means complete blood picture, or it is also written as complete blood count. Means what the blood what is the composition of blood? Composition of blood is plasma and formed elements. What in the formed elements? WBC, RBC, platelets. In CBP, we can check the values of WBC, RBC, hemoglobin, platelets. Understood? Next, complete urine examination means it is the examination of urine in case of chronic renal failure patients or any other edema patients like this. In this urine examination, we can find out any bacteria, which bacteria is causing the disease condition, and we can also by urine examination we can also confirm the diabetes of the patient. Next, high hr means heart rate. What's the normal heart rate of a person? Comment me down. Next, blood pressure. What is the blood pressure? Normal blood pressure 120 by 80 mm of hg, millimeters of mercury. High blood pressure is called hypertension. Low blood pressure is called hypotension. What is the definition of a blood pressure? Comment me down. Next, N by N and V, nausea, vomiting. Understood? Next, moving to SOB, shortness of breath. In case of any disease conditions of the respiratory system, the patient experience the SOB, means abnormal breathing pattern. Understood? SOB, shortness of breath. Next, LFT, liver function test. Understood? LFT, liver function test. Next, RFT, renal function test. Renal means kidney function test. Understood? And this going to be important. This is the important answer which is for 10 marks in the BSc nursing first year. Qualities of a professional nurse. May normally what are the qualities of a nurse? A nurse should be kindness, polite, punctuality, honesty, courage, healthy, loyalty, patience, impartial, self discipline, cooperative, simplicity, sympathy. Appearance, kindness, empathy. What is the meaning of empathy? I told you. Next, pose, care of others, respect, understanding, responsible, courtesy, and punctuality. These are the qualities of a professional nurse. Are you going to be the professional nurse? Okay, now I am going to explain some of the qualities of nurse in deep. First, respect for others. As we are in a nursing profession, we have to respect our elders and youngers also. As we are in a nursing profession, we should not proud, we should not be harsh towards others. Understood? We have to give respect to the every individual, elders or youngers. Next, patience should be there. A nurse should have patience. Nurse should have patience while taking care of patient with different emotional feelings. There will be different kinds of patients in the hospital. We should be patient. We should not shout, or we should not angry on the patient. We should be patience should be have to the patient. Next, impartial. Patient should not show partiality against religion, color, language, or people should not see. Nurse should not show partiality towards the rich people and impartial to the poor people. Nurse should should not be the impartial. Next, cooperative. Nurse should cooperate with the patient and family members. Should provide good nursing care. A nurse should provide good nursing care even when there is conflict or misunderstanding. Even if there is misunderstanding with the family members of the patient, the nurse should not scold or angry upon the patient or family members, should understand or be cooperative with the patient and family members. Next, honesty. Honesty means being truthful, sincere, and fair. Next, courage. A nurse should be brave. Nurse should be brave enough to face any situation. Like brave means if any case come to the casualty like RTA, road traffic accidents, nurse should not afraid by seeing the situations or by blood. Should provide the care in any situations or in any different cases. Next, health. Healthy means the nurse should be physically, mentally, and spiritually healthy, so which influence others. Next, loyalty. Loyalty means not talking bad words about the institutions or organizations which they are working in. Should be in loyal. Understood? Next, moving to punctuality. This is the first quality of a nurse, punctuality. A day of a nurse should be begin with the punctuality, being in a time, arriving to the hospital with the correct time. Nurse should be in correct timing in every aspect of life. It is the first quality of a nurse, punctuality, arriving or being in a time. Next, empathy. As I told you, empathy means assuming in the place of the patient so we can understand the situation and providing good care to the patient. Next, kindness. Noble means kindness. Understood?
Hi viewers, I think everyone understood the video and learned the important terms and abbreviations which are used in nursing course. And the next video will be about any topic or any lesson which you want. You can comment me in down. And next video will be regarding the based upon your comments. Bye bye.
Like, share, and subscribe.